All right. Let's make sure everything looks good. Let's make sure everything sounds good. Let's take a look. I think everything sounds good there. Okay, that's good. Let's just find this and share this on YouTube, and then we can, I think we can get going. So, just go over to Twitter here. Okay, I think that'll do it. I think we are live streaming. We'll see how this goes. So, good afternoon, good morning, good evening, whoever you are, wherever you are. I am Dr. Patrick Lockwood, but for the purposes of this live stream, I'm just Patrick, so please don't sue me, etc., etc. So, this is UnShrink Me, and for those of you who are brand new to this podcast, I want you to know that UnShrink Me is a weekly podcast, usually weekly at least, where I discuss topics in clinical psychology, psychiatry, counseling, etc., mental health more broadly, with the explicit goal of doing two things and only two things. Number one, criticizing ideas that aren't helpful for people. And then number two, criticizing ideas so that you, the consumer, especially the consumers of therapy, patients, their families, etc., can all have a better chance of getting what they want and what they need from their therapists, from their counselors, from their psychiatrists. So this is a podcast that is dedicated to everything mental health, that criticizes ideas, and also hopefully develops a more informed consumer base. That's all I care about. I just care that everyone who wants therapy, everyone who needs therapy, who's getting mental health help somehow, gets the help that they deserve. And when we're more informed and more knowledgeable, we can make better choices for our mental health. And that's all I care about. I am not giving you, as individuals, specific advice. So please understand, I am not acting as your coach, your counselor, your therapist, none of those things. I am simply acting as Patrick in here. So I'm not here to help you specifically. I'm here to provide general feedback to the general public so that everyone can understand better the choices they're making with regard to their mental health and their mental health care. So, without further delay, we have lots of cool stuff to talk about today, including we're going to talk about what exactly is a standard of care and how do you determine it and how is it healthy for people. We're also going to talk about motivational interviewing, which hopefully some of you are aware of and understand. Some of you might, and some of you might not. There's a big to-do going on back there with Max and Willow. What else? We also want to talk about, there's a couple of what is good therapy tweets that I'm going to discuss as well. So it'll be an interesting podcast. And I hope that for those of you who are brand new, welcome, welcome. For those of you who are not new, I hope that this is helpful and inspiring and encouraging in some way, shape, or form. And as always, for those of you who are new, this podcast is not sponsored by Celsius. However, I love it and it's good stuff. So without further delay, we're going to take a sip and get moving. Ah, that's good. That's good shit. All right. So, post number one. I'll start with a softball, and then we're going to move into more difficult territory. So, this first post is made by I think a New York Times bestseller therapist named Lori Gottlieb. And she's a pretty big Twitter therapist. So I just want to kind of talk about this post because I think it's current, it's important, and it generalizes to other topics we might discuss today. So let me just retweet her post real quick, and then we will move on. And for those of you who don't know, while I'm retweeting this, You can find me on Twitter or X or whatever you want to call it. And my handle is at Alobha Patrick, at ALOBHAPATRICK. And you can see what I'm tweeting and discussing with regard to mental health on there. Okay, so the very first thing I want to talk about today is from Lori Gottlieb, like I said. And here's what she said on 2/4, February 4th. Here's what she said. At a certain point, you need to make an important choice if you want to be happy. Point number one. Here's what she said. Do you continue to blame your parents for your circumstances as an adult, or ... do you take responsibility for crafting your life as an adult, despite the ways you suffered as a child? So this is a very common topic, how long you can be angry or resentful about your parents and the way they've treated you and helped you turn out this way. So the reason I wanted to talk about this is actually because of the first sentence, not the second and third sentence. So it's a very common topic. How long should I blame my parents? Should I be angry at my parents? Is it their fault? Is it my fault? Blah, blah, blah. That's all stuff that's been talked about forever and in a day. So I'm not here to talk about that as much. The part that's important is this. So you need to make an important choice, she says, if you want to be happy. So what I would say is this. A lot of people actually don't want to be happy. I think that's the bigger thing, is that when people come to therapy, I was talking with somebody else about this earlier this week, and they completely agreed with me too, which is not the norm, by the way. But what I was talking about was the fact that a lot of people actually come to therapy and counseling not to be happy. Most people come to therapy and counseling not even to feel better or create change. A lot of people come because they just want validation, right? They just want someone to agree with them and someone to make them feel important. And they don't even actually want to, quote unquote, feel better, which means create meaningful change in their lives. So to Lori's point, if you want to, feel better, if you want to be happier, maybe you should blame your parents less. And it's not to say that your parents have zero guilt or blame. It's just to say that perhaps, just perhaps, the fact that you keep putting all of this responsibility on what had happened, maybe you should start looking at the here and now, what you're doing about what has happened. Because most of the time, the terrible things that happen to us in childhood are actually very workable. Sometimes traumatic things happen in childhood that scar us permanently in a way that's very hard to manage. That's true too. However, in my experience, most people that have bad things happen to them in childhood can actually create a really cool life despite the traumas or shame or self-hatred or whatever they internalized as kids and young adults. So I just don't think most people actually want to be happy. I think it's easier to sit there and stare at the world and blame the world, and in some people's cases, pathologically blame themselves, as opposed to actually doing something different. Most people don't actually want to be different. Drew Linway says, 100%. I love Jonathan Shetler on this topic too. He's absolutely correct. I think Jonathan and I are of the same mind about this topic. The vast majority of people are coming to therapy, counseling, coaching, whatever it is, not because they actually want to change. Most people are coming because they really badly want to be validated, because often in life, sadly, people don't feel very valid. They don't feel like the world understands them and gets them. They don't feel seen by their friends, their family, their spouses, etc. And so, of course, they come to therapy just hoping to get a pat on the head, a hug, someone to understand them, use reflective listening to make them feel basically understood, which is sad. We live in a world where people can't do the basics correctly. And so, to Lori's point, taking responsibility for the here and now is the challenge, is the universal challenge in therapy. And most people don't want to, because they would like to hem and haw about the past because they were hurt, or they're worried about the future and they want to avoid the here and now by worrying about the future. The here and now is terrifying for most people. Sitting with yourself is a giant challenge, and it's hard for everybody, myself included. And so it's really important that people seeking out therapy understand quality therapists are going to help you understand how hard it is to change, and then help you find productive strategies to help you change. hopefully. That's the actual goal. So thank you, Lori, for the low-hanging fruit. I'll talk about something about lies and deception next week, but just know I've got a fun couples therapy tweet to discuss next week. So this next one is going to get a little spicy and a little scandalous. So just buckle up. But before I do that, I will check the comment here. Thank you, Drew, for being here, and everyone else who's watching. Drew says, I think I saw the tweet about meaning in therapy this week. I'm naturally inclined toward the deep meaning in therapy, but it's hard to balance that when clients aren't ready. So what he just said is super important. There is a balancing act that happens in all types of therapy, counseling, and coaching, where you see something more deep as a clinician or foundational or difficult to address, whatever, it's all the same thing. And you have to judge, you have to use discernment to figure out, is this person actually genuinely ready to deal with this or not, right? And that's tough because it's not always 100% clear when someone is actually fully ready. So what you do is you do respectful, informed, consent-based experimentation with the patient. You ask them, hey, I have this observation. Would it be okay if I shared it? That's it. It's not rocket science. It's genuinely just like either they can or cannot see it, or they agree or they don't agree, or it's obvious or it's not obvious. And if it is correct, even though they can't see it, they might see it at some point when new experiences show up with you or outside the world. So anyways, never is it rocket science. People just make it that way. All right, so this next one's an important one. But it's going to be a little scandalous, so just bear with me as we dive into something that's very difficult to talk about. So this next tweet, this next post I want to discuss is about a topic that's a huge problem in therapy land, the world's worst theme park. And it's the topic of sex and therapy. So I'm going to read the post. Let me retweet it real quick. This is by someone called Catbush, and their handle is at Feisty Kitty Pie. At FeistykittyPie. Feisty Kitty Pie. All right. Okay, so this is, sorry, just posting it real quick. So here's what Feisty Kitty Pie, aka Catbush, said on February 7th. Okay. He said, he, she, whoever said, therapist sleeps with patient. In quotes, not all therapists will get us nowhere. The more useful question is, under what circumstances, in parentheses, will therapists sleep with the patient? What makes some therapists more vulnerable than others? What can we do to help therapists talk about their feelings so they can avoid acting out? So, I'm going to say this as clearly as possible. I know it should be, I guess, common sense, though it's not super crystal clear for some people. So, a therapist, a counselor, a coach, a psychiatrist, a clinical psychologist, a family therapist, a whatever, by law and according to our ethics code, both the American Psychological Association's ethics code for psychologists, for me, and California state law say very, 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 very clearly that you are to never, number one, have sex with a patient. In fact, California has this lovely, terrible, corny pamphlet that says professional therapy never includes sex. Fair enough. But you are never to have sex with a patient, current or former. Never. Number one. Number two, which is a more complicated topic that I would like to spend some time talking about, maybe not today, unless the conversation kind of picks up around it, but dual relationships. Dual relationships are not technically forbidden. However, the APA's ethics code around dual relationships is fairly clear on this topic, which is we should really try to avoid them. I'm paraphrasing. We should try to avoid dual relationships, except in the most unusual of circumstances where we determine little to no harm can actually befall a patient, right? Now, that sentence is extremely vague, which is we should avoid dual relationships except in the circumstances where we judge that there will be little harm to the patient. However, we can't fully understand the future, for instance. We can't predict it perfectly, if even 50% of the time. So like you might think you create a superficial dual relationship with a patient, but a month from now, 6 months from now, it turns into something else because something has changed in the world, and now that dual relationship means more than it used to mean, and now you've really harmed the person or the potential need for therapy in the future. So I would say, on the conservative side of things, maybe try not to have dual relationships at all if it's possible, would be my general feedback or guidance to anyone, which is what I say to my interns that I supervise. So let's go back to the original topic from Cat Bush. This is very important. So it's therapist sleeps with the patient. Oh my God, not all therapists. But this isn't helpful, as Cat Bush said. So the first question is, under what circumstances would a therapist sleep with a patient? That's the first question. And the second question that Cat Bush posed to the world was, what makes a person, a therapist, a professional, more vulnerable to the desire to sleep with a patient? So this I can actually say a lot about because as a clinical supervisor, I talk with people about this in my role as a supervisor. So there's a number of things we should talk about first and foremost. So the first thing we should really talk about is this thing called the eroticized transference. So there are technical ways of explaining it, but for the sake of not boring the shit out of everyone, the eroticized transference is when a patient sits down with a professional, a therapist, a doctor, whatever, and starts to experience a love-like set of feelings, either erotic or just friendly, towards the therapist, the psychiatrist, whatever. So the person in the authority role, the professional, is starting to be viewed as this love object. It's, I have a fondness for the person, the patient might say, or I really, they make me feel like my ex does, or they make me feel like my husband does, or whatever it is. And so the eroticized transference is like this reaction patients can have sometimes to therapists and psychiatrists and counselors is completely ordinary because in some instances, that will be not weird to have such a close relationship or to talk about such detailed and difficult and intimate things that it's a little bit like an intimate relationship. Not that the boundaries, hopefully, should be there, but we'll talk about that in a second. But like, even if you set the best boundaries in the world and you're perfectly clear at the beginning of therapy never includes sex. I'm not here to be anything but your professional helping you walk through this clinical problem. You can say that to the cows come home, and sometimes people still develop feelings for you. That's not weird. Now, what you do with that is where we get to a very interesting place with regard to Cat Bush's question. So, what makes a therapist more vulnerable than others? So, probably one of the worst things in the world is when a therapist is not very aware of the eroticized transference that's happening. Right? So the patient is extra nice to the therapist. The patient's extra complimentary to the therapist. The patient even flirts, maybe subtly or not so subtly, with the therapist. And when that happens, if you're not aware of it or not treating it like the big deal that it actually is, then you might actually be subtly encouraging it. So when a therapist starts to subtly encourage it, that's a huge problem. And so as opposed to addressing it, you don't address it. That's problem number one that can happen. Problem number two is countertransference, right? So it's very common for therapists to have feelings, urges, motives. Hey, Phil, good to see you. That they're not aware of. And so that's what we call countertransference, where we have feelings from our past or our present that we are experiencing in the therapy with the patient. So if I have issues with my dad or issues with my mom, and I'm treating an older patient who's a male or a female, and I'm starting to develop a dynamic with them, an interaction style with them that's similar to my dad or similar to my mom, that's where countertransference on my end is coming in, right? I'm showing up some type of way because of my feelings and my biases. And that happens around sex and attraction all the time in therapy, unfortunately. And so people can't see it. People can't see that therapists, cannot see that they have unmet romantic or intimate needs that they are playing out with their patients. It happens all the time. So when I do supervision, I ask my supervisees, are you noticing any particular positive feelings about the patient? Very simple question. And what are they? Right? Or negative feelings. Both can kind of be the sign that something is there. So those are two reasons why people are more vulnerable to sleeping with their patients. Eroticized transference not being managed well, countertransference not being managed well. Reason number 3 is a lot of therapists, maybe not all, maybe not even most, maybe it's 50%, maybe it's 40%, but there is a sizable percentage of people who become therapists because they're trying to manage their own shit. And they're trying to have a distance from their own personal issues. And because they're trying to have distance from their personal issues via professionalism, they will unknowingly start to act in this godlike way with their patients. They will pretend or believe that they are more smart, more aware, more savvy than they actually are. And so I would call that ignorance of your personal needs, right? So one reason that the sex with patients things happens is eroticized transference not managed well. Number 2, countertransference issues not managed well. Number 3, denial about your narcissistic need to feel important and special. Many therapists, I'm going to say this over and over again, many therapists of all kinds come from a background of not feeling important enough, all this depressive position stuff if you're analytically inclined, all that stuff. And so because they have this need to feel important, unfortunately, that need to feel important can be hijacked very easily by situational issues with a romantic partner, whatever it is that make you more interested in your patient than you should be. That happens all the time in therapy. Sometimes it's very subtle and not toxic and not damaging. And sometimes it's like outright flirting, which is disgusting and gross, and therapists should not be doing that. Okay? So those are 3 very common reasons why narcissistic issues, power, importance, love, grandiosity issues with therapists, countertransference, and eroticized transference are 3 very common reasons why therapists will kind of slippery slope turn into people who have sex with their patients. And it's never okay. It's never okay. It's just never okay. It's never okay. Unfortunately, it happens a lot more frequently than people would like to think. But it's never okay. Because it's wholly pathological. You are using your power, your privileged status position as a professional to manipulate this person sexually or intimately or both. And that's never okay. That's not real love. That's narcissism. That's ignorance. That's selfishness. And so why are people more vulnerable? Because they have a bunch of shit they haven't dealt with. There are many, many, many unwell people who are not fully aware of the ways in which they are unwell. Most people realize that they've been neglected or something like that, and that's why they want to be therapists, but it's also more complicated than that. You know, it's usually much more complicated than that. So fully dealing with how complicated it is the work, in my opinion. So thank you, Kat Bush, for opening up that conversation. If there are other reasons you all think this can happen, let me know. Say more in the comments or, tweet at me. Let me know. All right. Why don't we somewhat mildly shift gears, even though this is not fully shifting gears. So, Nick Tabor. Nick, I hope I'm saying your last name correctly, because I know I talk about you all the time, and I don't know if I'm saying it right. Anyways, so Nick always has some good grist for the mill on what is ethical therapy, harm, all these fun things. So I want to talk about a post he made literally a couple hours ago. Because I think it's a really important post, and I think it speaks to a broader problem in therapy land, again, the world's worst theme park, that most people don't fully recognize. So let me discuss this real quick. Or let me retweet this, real quick. All right. Awesome. All right. So here's what Nick said about 2 hours ago at NICKTABER. He said, I just worry that when we think some standard of good therapy has been established, there's a mountain of epistemic violence baked into that. I love these philosophy words. So, I want to compliment Nick and talk about what I think is really good about this, and then I want to challenge it. I'm going to try to be fair. He said, I just worry that when we think some standard of good therapy has been established, there's a mountain of epistemic harm baked into that. So, what I like about this is he's talking about a problem that currently exists. This is not something that is made up. This is not a fantasy. He's not some paranoid, psychotic, out of his mind person, at least I'm aware of. And this thing, Dr. Rollergator says, you have epistemic bloodlust. Do you really? See, epistemic bloodlust, you're probably going to find this video, sounds like a metal band. Epistemic bloodlust sounds just like a metal band. So good job, Dr. Rollergator. You're such a wordsmith. I think there's a really cool, by the way, glad you're here. Good to see you here, Dr. Rollergator, Twitter famous. I would say there's a real problem that currently exists in psychotherapy, which is there are ideas, there are beliefs, there are concepts baked into therapy, training, ethics, all this stuff that actually can be harmful, right? And so he's not wrong that we can establish standards, and those standards can have problematic, consequential, or even toxic components to them. And I'm going to name 2 of them, and then if you want to name some others, feel free to let me know. So the first one that I think is absolutely real is like something that's already baked into therapy excellence, if you want to call it that, standards, is the idea of helping people. So I think this is a particularly pernicious belief. So you helped the patient, or they got better, right? So this idea that somebody gets better is actually, I think, rather pernicious and will cause harm to people. And the reason's because many people are never going to, quote unquote, get better according to normal, societal demands, right? So there are some people who will literally be psychotic for the rest of their life. They will experience hallucinations and delusions forever. And so if getting better is your standard, and getting better means you're going to help them, they're going to achieve some sense of normalcy, right? I think normal is epistemically harmful, not in the social justice woke version of this conversation, but in the practical reality, which is, what the fuck actually is normal? Can someone really tell me definitively, statistically, on a Gaussian distribution kind of frame of this, what precisely is normal? Is it freedom from certain things? Is it the presence of certain things? I don't think we actually know what mental health really genuinely is. So I think normal, being helped, these kinds of things, these 2 things are pernicious and demonstrate harm to people, because I don't want most people to be normal, in the sense of, I think that social norms serve specific purposes at the macro level, but are destructive at the individual level. So what I really want people to do as a clinician is I want them to find adaptive ways to manage their world, which is very different than normal, right? So if cursing in public is not normal, for instance, and maybe you curse because you have Tourette's syndrome, or maybe you curse because you have a bad case of PTSD and you're fuck the world and all this stuff, or maybe you're depressed, or maybe you're psychotic, or whatever it is. And I don't really care that the world doesn't want you to curse. That doesn't really mean anything to me. In fact, it means shit to me. I would say that there might be some adaptive context where cursing less would be useful, for instance. However, if you're ill enough and cursing is the worst thing that you got going on, maybe your life is okay, right? So I think the normal thing and the help thing is very pathological. And that's baked into a lot of therapy training. A lot of professors will stand up in front of class and say, like, your job is to help people and not harm them. It's like, I don't know about that, man. I think harm is inevitable. I don't want to harm people. That's not what I'm shooting for. It doesn't feel good to me. However, I know that because I'm a regular person, I will say and do something that is hopefully on the more minimal side, but still harmful. I think it's unavoidable. So I think the idea of helping people is too general, and it is toxic because helping is very subjective culturally and so on and so forth. Like, what if people don't want to feel better? I was just saying this at the very beginning of this. So many people come to therapy not because they actually want to change their behavior and have a more meaningful, adaptive relationship with themselves and other people. So many people come just to get a pat on the head, or just to get validated, or just to feel seen, which is not really changing anything. So to me, I think we should probably have some real conversations around, as Nick calls it, epistemic violence. So to Nick's point, I say there are probably many things in the APA's ethics code that could actually be harmful to different groups of people, right? And I'm not saying that that's the norm. I would argue, this is my argument, that the vast majority of people that come to therapy either aren't helped or aren't harmed. So nothing really bad happened. And that's okay. And then a lot of people that come to therapy are helped, which is awesome. So here's what I don't think is specifically useful about Nick's post here. So he said there's a mountain of epistemic violence. I just don't think it's going to be that huge a problem, right? So like, if I just pick one of the standards in the American Psychological Association, right, that I think is perfectly defensible and probably not pathological at all. One of the standards to be an APA accredited school and to do good training is to always regard culture and context in your diagnostic process. So when you teach a class that's about diagnosis like I do for a living, and maybe this is my bias because I do it for a living, maybe I have some defenses around it. I don't think so. I think this is just common sense, what I'm about to say. So the APA dictates that when you are teaching diagnosis classes, you always try to triple check whether or not you're making a decision about behavior as pathological in the context of somebody's culture. And the reason that's a big deal is because many different people come from backgrounds where they don't even see anxiety the same way as a Westerner might. You know, different cultures don't even have words for these mental health concepts that we have here in the United States. So there is a genuine language problem. And I think it would actually do more epistemic violence to get rid of that standard by the APA, dear Nick, than it would be to keep it. I think more harm will befall people if we remove the standard of making sure we always consider culture and context when we're trying to diagnose somebody. Because I don't want to give somebody a diagnosis if they come from a world where their anxiety is normal, right? This is a stereotype, so feel free to fire me. However, like lots of people from Southeast Asian cultures that I know come from very collectivistic, socially anxious, trying to be proprietary and prim and proper environments, because that's more normative in those parts of the world where they come from. And so I'm not going to be as quick to give them a social anxiety disorder diagnosis if I know they come from a very collectivistic family that's very externally focused. Maybe it's adaptive for them to be a little more socially anxious. Maybe that's where they come from. Maybe that's what allows them to fit in and thrive in their world. So like, I think that standard by the APA is perfectly useful, and I don't like the APA at all. However, I think some of their standards are very reasonable and very common sense. So, dearest Nick Tabor, I hope you understand that many of the training standards that the American Psychological Association has for us are pretty useful in a very common sense and practical way. Some of them are not. Some of them are idealistic and stupid. But I think things like what I just mentioned about considering culture before you diagnose seems pretty common sense and useful. So, dearest Nick, I think there are not mountains of epistemic violence. I think there are some exceptions where epistemic violence happens, but I don't think if you like looked at every piece of the APA's training dictates, which I think you should. Nick, I've got a project for you, which is take a look at all the standards for accreditation for the American Psychological Association. So to be an APA accredited school, I challenge you to look at all of them, and there are many of them, by the way, and see how many of them have quote-unquote epistemic violence baked into them. I think you'll be shocked at how few there are. And again, this is coming from the guy that does not like the American Psychological Association. That's why I'm not a member, and I haven't been a member for a very, very long time. I think they suck. I think they're useless. However, they have a political role in the world, and they do some safeguarding that I think is useful. And I still think their code of ethics is pretty good, right? So like an adult, I can have conflicting feelings about it and talk about it and be honest about it and not be ridiculous about it. So, dearest Nick Tabor, I think you have experienced so much harm, this is my guess, and you see so much harm that you might overgeneralize a bit. Phil has just commented something that I think is really awesome. Phil says, by the way, thank you for being here, Phil. To be anxious is a good thing. In fact, in many cases, anxiety is very, very useful. It's a motivating force that allows us to be oriented and alert towards future or even current problems. So anxiety has a very useful place in the human mind in relationships as well. So I agree with you, Phil. There are many cases where anxiety is useful. However, the problem I see as a clinician and as a professor and as a consultant, boy, I see this all the time in my consulting world where I'm trying to help people navigate staffing decisions or finances or whatever. Anxiety can be very adaptive. It can also be very maladaptive because it causes you sometimes. It can cause people excessive anxiety, mismanaged anxiety. Anxiety you have a bad relationship with is the way I would phrase it, where the anxiety is in control, so to speak. That can also force you or push you in the direction of things that are self-sabotaging. So it's tricky. It's not a one-size-fits-all feeling. But I do generally agree that more people would do better with a little more anxiety so they're more motivated to pay better attention. So for what it's worth, thank you so much, Phil. And again, thank you, Nick Tabor, for bringing epistemic violence into everyone's Saturdays here. All right. So the last post I would like to have a little fun with is from one of my online therapist buddies. He is the People's Therapist, and his handle is at Career Flex, CareerFlex. So my buddy Jake, the People's Therapist, let me just retweet this real quick because I think it's a good one. Okay. So my buddy, the People's Therapist, has said this a number of times, and it's a trendy thing because it's a therapy thing, it's a culture war thing, it's a lot of things. So admittedly, it's going to appeal to a lot of people, and I said what I said for a reason. So let me describe his original tweet, and then you can see the thing that I retweeted as well. So here's his original tweet. He said this, I think, last year, May 6th, 2025. He said, most therapists coddle. I challenge, period. Insight without action is sentimentality. So, excuse me. He said, I challenge. Most therapists coddle. I challenge. Insight without action is sentimentality. I'm going to come back to that. Here's what I said. I neither coddle. This is what I said 7 hours ago today. I said, I neither coddle nor challenge. I use respectful curiosity to highlight discrepancies. Hashtag motivational interviewing. So the reason that I am having a little fun with my friend here is because I think there is this war that's been happening in the culture wars around therapy and mental health, which is, a lot of people on the right side of the aisle somewhat correctly, but also somewhat incorrectly believe that, lefties and wokies and blah, 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 blah have been making people soft and low T and all this stuff. And they're coddling people in therapy and they're just, they're victim glorifying. Yes, you're a victim and go queen and yes, queen and shit like that. And I'm sure that happens. And I'm sure that there are many therapists who do not, quote unquote, to use Jake's word, challenge people. And I agree that when you coddle people, when you treat them as if they are fragile, when you never have a relationship with them, because that's what happens. If you're just coddling people, you're basically avoiding a real therapeutic relationship with the person, right? So if all you're doing is validating people, if all you're doing is making them feel good, if all you're doing is making them feel heard or seen or safe or some shit like that, then yes, you're coddling people because you're not having a real relationship. You're just a paid pacifier. And you do not go to graduate school to become a paid pacifier, right? A pacifier would literally be cheaper. Just develop an oral fixation. Buy a can of Zins or something. Not that I'm endorsing nicotine use, but just develop an oral fixation and your life will be way better than spending a bunch of money on a therapist. However, this idea of challenging people also has problems, which I will discuss when I talk about my tweet. But before I get to my tweet about challenging as opposed to coddling, because it's not a dichotomy, that's problem number one, which I'll get to that. Insight without action is sentimentality. So I was just having a row earlier today on Twitter, on ye old Twitter, with some psychoanalytic person about, people not changing for years and all this stuff. So the people's therapist said, insight without action is sentimentality. I could not agree more. Being aware of something and doing nothing about it is just patting yourself on the back or masturbation or whatever it is. And that's such a waste of time. If you are in therapy and all you're doing is quote unquote gaining insight, what a waste of time. And the reason's because, and I said, if all you're doing is gaining insight, right? So if all you're doing is exploring a curious puzzle together, then why are you in therapy? That's not therapy. That's having a friend. That's just waxing philosophical about your life, which is not change. So therapy is change, right? So yes, I agree with the idea that the people's therapist said, which is insight without action is sentimentality. So our job as professionals specifically is to focus on the ideas and feelings and goals that you have created with me in therapy to change, right? That's what we're here to do. We're not here to masturbate about your childhood or whine and complain about your childhood. We are here to understand whatever is happening and whatever has happened with the specific focus of a goal that we have created together. So sometimes talking about your past is extremely useful because illuminating the past and exploring patterns from the past and how they're showing up today is wildly useful. I do that all the time when I do clinical work. That being said, we also have to acknowledge the here and now and what we're doing with the past in the here and now. Because if we're not doing something with it, then you're literally just verbally masturbating. And what a waste of time. So let me talk about what I said about his tweet. So I said today, 7 hours ago, I neither coddle nor challenge when I do therapy. I use respectful curiosity to highlight discrepancies, something that people in the MI world call the Columbo approach. If you have not seen the television show Columbo, I really hope you watch a couple of episodes because, they're all kind of the same episode over and over again. But he did a great job. He did a great job as Columbo. And the reason it's such a good approach clinically is because it embodies all the principles of what's called motivational interviewing, right? So in motivational interviewing, for those of you who don't know, this is something I love to lecture about and supervise about. So just real briefly, just bear with me. Motivational interviewing has a couple of foundational principles that everyone who's trying to practice this therapeutic skill should know and be living by as you do it. So three foundational principles that I'll talk about real quick for MI. And it'll explain why I said what I said. I use respectful curiosity to highlight discrepancies. Mountain Girl says, I love your debates with Nick Tabor, by the way. Some of the best content I've seen on X and Ages. Well, thank you so much. That's a very nice compliment because, I don't set out to have good content. I set out to just tell you what I think, So love to hear that. I'm glad that you like it. I hope that you can chime in if you see something you disagree with either of us about. We can add to the conversation, please. The more, the merrier. So going back to motivational interviewing. So there are three more, but three of the most foundational principles of MI are as follows. Number one, all people deserve respect. Number two, people need to come to their own conclusions about change. And number three, change only happens when you are a collaborator and you're evocative. So I'm going to walk through these very quickly, right? So number one, all people deserve respect. And what that means is the patient deserves respect. And the most frequently cited, most common ways that patients are disrespected is when therapists try to convince people of what to do. So if I'm trying to convince you, I'm not respecting you. I'm being a lawyer. I'm manipulating you. I am not being a therapist. That's disrespectful. Also, patients are disrespected when you ignore their values and their needs, right? And that happens all the time in therapy because I'm the expert who knows better. You should be doing what I say. Because my values are more important than your values, right? So therapists disrespect patients all the time by trying to convince them, trying to manipulate them, coerce them, psychoeducate them, whatever it is. But therapists also disrespect themselves in therapy all the time. For instance, when therapists care too much, they're disrespecting themselves. When therapists take on too much responsibility in therapy, they're disrespecting themselves. So this disrespect problem happens all the time and it goes both ways. So number one, all persons deserve respect. Number two, people need to come to their own conclusions. So when I turn into Lawyer Patrick and not Dr. Patrick, I'm trying to convince you I'm no longer respecting you, number one. Number two, I'm trying to convince you of something. My job is not to ask leading questions to help you change yourself. That's being a lawyer. That's not being a therapist. So number one, all people deserve respect. Number two, people need to come to their own conclusions. I am not to coerce you, manipulate you, etc. Number three, the best therapy, real change only happens when you're being a collaborator, when both parties are equally responsible for change. And number two, when you're being evocative, which means you're causing people to have feelings. You're not being boring as shit. If your therapist is boring, fire them, I say. Either that or you're boring. Either way, it's a problem. So what I would say, and again, that's not specific advice. Don't fire a therapist. I'm just being silly and evocative. So here's the deal. Good therapy, number three, change can only happen when you're being a collaborator. I'm not being a dictator telling you what to do. I'm not being passive and just letting you do stuff. I'm equally involved, 50-50. But also, I'm being evocative. I'm being a real person. I'm having real feelings. I'm doing real things with you, right? So that is the MI way. Those are the three foundational principles of motivational interviewing. And so, this is why I said what I said. I'm not going to challenge you because that's me being evocative, sure, but not respectful. Challenging people is not respectful. It's just you being a lawyer. And Socratic questioning is a part of CBT and stuff, but if you're not being respectful, you're just coercing people, manipulating people, which I have a huge problem with ethically. So in the motivational interviewing world, we're taught to do this thing called highlighting discrepancies. And so that's why I brought up Columbo, because that's the Columbo approach. He hears you tell a story that's a lie, and then he brings up information that counters your lie and asks you questions about it. So this happens all the time in therapy, right? I highlight discrepancies all the time in a very curious way. And I usually start with this really cool, here's some free advice. Here's a free tip for everyone. If you want to have healthier, smoother relationships, here's a tip. Try curiosity as opposed to challenging, questioning, being defensive. Right. Also, here's another tip. Try asking for permission. Some of you right-wingers will hate this, but here's the truth. If you want to have a better relationship with people, try it. So here's how it goes. If I think someone is lying to me in therapy, if I think someone is unaware of something in therapy, I will often combine the motivational interviewing skill or the therapy skill of asking for permission and then highlighting discrepancies simultaneously, being curious with the attitude of curiosity, not with the attitude of, I gotcha. Okay? So here's what this looks like. If I believe a patient's across from me lying about their desire to get sober, because I work in Rehabistan, I'll be curious and I'll ask for permission. Would it be okay if I shared an observation? So asking for permission. Would it be okay? That's it. They have the right to say yes or no. That's it. If they say no, then you shut the fuck up. And then you just are curious about other things. It's that simple. If they say yes, then you share your observation. That's what highlighting the discrepancy is. So it's like this. You've told me over and over again that you don't want to be sober. And I hear you. And you totally, it's very believable. I get it. You've been through all this hell. I understand. However, I'm very curious, and help me understand. You say that you don't want to be sober, and yet you're also doing this thing where you're talking to your ex who's still using. So I'm a little confused. How much of this desire to be sober is true given how much you're interested in this person who's still using? Because it's not black and white. It's like a spectrum thing. So is it you 80% want to be sober? What is it? That's inserting a scaling question too. So genuinely speaking, highlighting discrepancy is different than I don't believe you want to be sober. Stop lying to me. You're lying. You're still talking to your ex who was getting fucked up and da-da-da-da. That's challenging, right? Stop lying to me is challenging. And so the problem with challenging behavior is it worsens resistance and defensiveness. And my job is to roll with resistance in the MI world, is to just be open and be a collaborator. Because the know-it-all version of me knows you're full of shit. But the know-it-all version of me is not the version of me you're paying money for. You're paying money to have a collaborative clinical relationship where we are equal parts responsible for an outcome based upon a goal that you created with me. So I'm going to do this 3-part thing, or at least this 2-part thing, which is attitude of curiosity, starting with asking for permission. Would it be okay if I shared an observation? And part 2, highlighting a discrepancy. There's a discrepancy between what you say and what you're doing. I want to understand why there's this discrepancy. I don't want to correct the discrepancy. That's your choice. If you don't want to correct the discrepancy, awesome. Because all of us have some conflict in life, and conflict is normal. What's abnormal, what's pathological, is when we let the conflict run our life and destroy our lives. However, if you don't want to change that, that's your choice. It's not my job to keep you from destroying your life, for instance, with drugs and things like that. So I hope everyone understands that I think challenging is great and useful, and maybe there's even a situation or two where you can make a case for it. However, I don't think that's the most respectful tactic. And I don't want to disrespect people. People are literally paying me to be the adult in the room. So if I let my infantile whatever shit out and I just challenge you like a lawyer, that's about me. That's about my bullshit. That's not about you. right? And what you say you need from me, right? So ethical clinicians, I hope, are interested specifically on asking for permission, which is a great skill. If you have a romantic relationship or a family relationship you're trying to improve, try the therapy skill of asking for permission. Would it be okay if insert whatever you want? I asked a question, I explored something, whatever. And also highlight the discrepancy. You're saying this thing, but your behavior contradicts it. Help me understand. You're acting this way, but what you say you want contradicts it. Help me understand. And help me understand has to be genuine curiosity. It can't be this bullshit I gotcha stuff that only works on Columbo. It doesn't work in therapy. Because if you have the gotcha thing going on, that's you being a narcissist. That's you letting your insecurities as a professional run your behavior. Stop it. So, Drew says, related, Shedler is big on phrasing questions as statements to prompt reflections. Yeah, it's a decent tip for sure. So again, the people's therapist, my buddy Jake, I get why you say challenging needs to happen more because a lot of the other types of therapists haven't done any MI or any challenging. I would say that challenging is mostly not respectful, though. That's my only problem. And if you want to challenge people in your everyday relationships, go for it. However, here's what I would argue. If you're challenging people, and I'm a fairly disagreeable person, so I'm not trying to be a hypocrite or anything. If you're challenging people a lot, you're going to be pretty miserable. And some misery is necessary. Preventative misery is what I call it, is necessary. But, if you're challenging people a lot, maybe that's about you and your shit. Maybe you feel insecure. Maybe you feel like you needed to be protected or vindicated or whatever it is, even if you are temperamentally disagreeable. Like, maybe you should take a look at why you want to challenge people so much. And that's tough because it's complicated. We are not simple one-dimensional creatures. So I don't know. I genuinely don't know. But anyways, in therapy land, the world's worst theme park, I recommend using motivational interviewing and not challenging people. I recommend that you find clinicians who know how to ask for permission and highlight discrepancies. Because when they're highlighting discrepancies with you, if you're a patient right now, if you're a family member of a patient, and they're complaining about their therapist, if the therapist is doing the right thing, in my opinion, which is highlighting discrepancies, please help me understand how you're saying this one thing over here, but your behavior contradicts it over here. I don't get it. I'd like to understand it. Because then the onus of responsibility is on the patient to resolve that discrepancy, sit with it, or worsen it. That's not on us. It's not our job to push people in a particular direction. It's our job to be curious and explain our concerns. I do this in Rehabistan all the time. You say you want to be sober, but you want to go live with your drug-using ex-girlfriend or boyfriend or whatever. Like, help me understand that. How is that safe for you? I don't know. I can't know. Maybe you have an explanation that I have not considered. That is real. It's possible. Maybe you just don't care. Or maybe you care, but you're afraid to look at the full complement of facts that relate to this situation. Maybe you don't really want to be sober. And if that's the case, that's awesome. Thank you for telling the truth. Telling the truth is awesome. Now, what you want to do with it, that's up to you. But the fact that you told the truth, for many people, that's hard to do, and good on you for telling the truth. So I hope everyone understands the context in which I say these things. So that's all the time we got for today. Time flies when you're having lots of fun. Thank you all for being here. A lot of cool comments and questions. Drew, Dr. Roller Gator, Mountain Girl, Phil. Thank you for being here. It really means a lot to me. I mean, I'm just some dude talking into a microphone, but this really is very meaningful for me because I want to make sure everyone gets the best chance to get what they need out of their therapist. So, for me, I really hope that genuinely something I've said here was helpful, was useful. And I hope that for those of you seeking out therapy who hear this or watch this, you understand that I am not giving you specific advice, obviously. I'm not here as your therapist or consultant. I just want to talk about what I think is generally effective and generally helpful and generally bullshit. That's my goal, only goal with this podcast. Because I think if we have a better, more refined understanding, specific understanding of these things, we can succeed more in helping people, and you can get the help you need from people. So that's the only goal of this podcast. So thank you all for being here. Please, please, please do me a solid and like and share and subscribe. Help me build a bit of an audience so we can get more people engaged in the conversation and we can talk these things out and I can be challenged more. I love that. So thank you all for being here. And as always, I like to end this podcast with a joke. So without further delay, here we go. I once had this patient, very, very political patient. And as most of you know, if you followed me on Twitter for some time, I despise politics, whether it's conservative politics or wokey, left-wing, whatever politics. I despise all of it personally. But I don't talk about it in therapy because it's not my job. It's not the topic du jour. So anyways, I had this patient who I think probably most people would call a lefty of some kind. And this dude, who I think is a good guy. I think he's a very, very good guy. I think he's an ethical person. And I think he just has a very strong sensitivity to like mean, nasty assholes. And for what it's worth, a lot of the people on the right side of the aisle are mean, nasty assholes. So his complaints in therapy were he has all this frustration and exhaustion. He's burnt out at work, all these things. And I think one of the reasons he's burnt out is because he cares so much about politics. And fair enough, a lot of people do. Their brains are politically addled, in my opinion. And I think he's one of them, unfortunately. So anyways, we're in therapy. I'm trying to work on ACT, acceptance and commitment therapy with him. We're talking about values and living in accordance with your values and kind of reordering the hierarchy of his values so he's less burnt out, right? And he's talking about all this political stuff, and we were just, because we're similar age, and, you know, he's like, I remember the 1990s and the early 2000s. It just seemed like everything was better back then. He kept saying it. He's like, and I personally, I kind of agree. Life was a little bit better. We kind of were a little more unified, not full of shit back in the 90s, and we didn't hate each other as much. And we had known each other for a couple of months at this point, so I felt a little more freedom to joke around with him anyway. So we kept talking and reminiscing a little bit about, you know, the past and his values and things like that. And he's like, I just, you know, there's just a piece of me that wishes that I had a time machine and I could go back to the late 90s and early 2000s because it just seemed like everything was okay back then. And I looked at him and I said, it kind of sounds like that you kind of wish you could make America great again. All right, I hope you have a great rest of your Saturday. I hope you're out there taking good care of each other, have good sex, have good food, have good friendships, have good family relationships. Take good care of each other, and I will see you again next week for more fun next Saturday, 3 o'clock.